If you feel like your whole system is on edge, you're exhausted but wired, your pain moves around, your sleep is broken, and everything flares for no reason, and every time someone just treats the sore spot, it helps a bit and then it all comes back. If that sounds like you, stay with me. I'll explain what NESA is, how it works, and how we use it at Unpain Clinic. Most people we see for NESA neuromodulation have some kind of mix of difficulty falling asleep or staying asleep, pain all over the body like fibromyalgia or nerve pain, digestive issues or bowel changes, bladder control issues, feeling constantly in fight or flight and never really in rest and digest. When someone says, "My nervous system feels like stuck on high alert, I can't sleep properly, I don't recover, I feel wired but tired," that's when we think you're exactly the kind of person NESA was designed to help. What is NESA neuromodulation? NESA helps your nervous system conduct and communicate better, so your brain and body can actually talk to each other the way they're supposed to. Your nervous system runs on tiny electric signals. When those signals aren't getting through properly, you can end up with pain, poor sleep, digestive problems, and body cannot shift out of the stress mode. NESA neuromodulation is a non-invasive electrotherapy that uses very low strength microcurrent to talk to your nervous system. You sit or lay down. We place the small electrode on your hands and feet, and sometimes one on the base of your neck. Those points connect into your major nerve pathways. Inside your body, NESA is targeting autonomic nervous system, the system that controls your organs, heart rate, breathing, digestion, and more. We use specific programs to balance the fight and flight versus rest and digest. Stimulate vagus nerve, which connects your brain to your heart, lungs, and digestive organs. Influence cranial nerves involvement in pain, sleep, and mood. You can think of it this way. We send gentle, medical-grade signals through the nervous system. This helps rebalance how the autonomic nervous system is firing. Over time, your sleep, recovery, digestion, and pain regulation start to normalize. In simple terms, NESA provides a very gentle electric input to your body's regulatory circuit. When your autonomic nervous system is stuck in alarm mode, fight or flight, you get poor, shallow, or non-restorative sleep, pain that moves around and flares up easy, a body that would not calm down even when the original injury should have healed. NESA's microcurrents are designed to help shift that system back to normal, rest and digest, and recovery. We're not trying to numb the pain or make a single muscle contract. We are nudging the control system that shapes how you process pain, how you sleep, and how you recover. This is not 1 or 2 session treatment. The minimum meaningful course is usually 10 sessions, done 2 to 3 times per week. Nerves change slowly. We are guiding your system to heal itself, not focusing a quick artificial change. Published NESA neuromodulation studies have reported around 60% reduction in pain perception in various groups, about 40% improvement in sleep quality, which increases in total sleep time and REM sleep, measurable improvements in quality of life and cognitive function, objective changes in autonomic and vascular physiology, even when patients don't feel the current. The strongest evidence is for improvement in sleep, autonomic balance, quality of life, and related pain and recovery. Individual responses may vary, and we always explain where your specific cases fit. How is different from what you've already tried? Physiotherapy and exercises are crucial, but if your nervous system is stuck on high alert, progress often stalls. NESA targets the regulatory layer underneath so the rehab can stick better. Pain medication can take the edge off, but it doesn't change the system driving the pain. NESA is a non-pharmaceutical and works on the control circuit themselves. Cortisone injections calm local inflammation, but not why your system keeps sounding the alarm. NESA works at the system level driver. Tense units buzz and temporarily overdrive pain signal. NESA is a subsensory and system-wide. The intent is long-term regulation, not just temporary overdrive. NESA is not a replacement for everything else. It usually works best as part of broader plan with rehab and education, not instead of them. What does NESA do for you if it works? When NESA works well, the first thing most people notice is sleep. They say things like, I fell asleep faster. I woke up, but could actually fall back asleep. I feel calmer, not as reactive. As sleep and autonomic balance improve, people often report more energy, less brain fog, more mental clarity, feeling calmer and less anxious, better digestion and less gut chaos, gradual reduction in widespread pain. Over a full course, usually 10 to 20 sessions, about 8 out of 10 of the right candidates notice significant overall improvement. What's unrealistic is expecting everything to change in 3 to 5 sessions. Some people feel a shift that early, but the bigger effects usually accumulate between sessions 10 and 20. What does NESA treatment look like at Unpain Clinic? On your first initial assessment, we look at your pain history, your sleep quality, your stressor patterns, your movement, signs that your nervous system is stuck in alarm mode. We then decide if NESA makes sense for your case, or if another approach should come first. You leave with a clear written plan and transparent pricing before you commit. The active treatment phase is typically 10 sessions and often 60 to 90 minutes each. Electrodes go in your limbs and sometimes your neck. You relax. Most people don't feel the current at all. Many nap. We often combine NESA with other modalities and rehab, so you're working on both the system and the tissue. We track your progress using heart rate variability, other physiological markers, your pain and sleep reports. That way, even if you don't feel the current, you can see your physiology change over time. As you improve, we layer in more active rehab, strengthening self-management so change lasts beyond the treatment course. What does NESA feel like and is it safe? Before your session, there's no special prep. Just wear comfortable clothing. During the session, most people feel nothing or very faint sensation at most. That's normal and intentional. Afterwards, there's no downtime. You can drive, work, and go about your day. Over time, common experiences including feeling calmer and sleeping better. NESA neuromodulation is widely considered safe and well tolerated. Reported side effects are usually mild and temporary, like light skin redness at electrode site and a bit of tingling or occasional mild headache. We do not use NESA if you have a pacemaker or active electronic implant, open skin issues exactly where electrode would go, or certain unstable cardiovascular conditions. And if your pain is clearly from a pure mechanical problem, we may start with other treatments first. All of this is reviewed in your assessment. Your next step. If you're tired of feeling wired but exhausted, sleeping badly, and chasing pain that keeps coming back, NESA might be part of the answer. Your next step is simple. Book your initial assessment. We'll assess your pain and your nervous system, tell you honestly whether the NESA fits your case, and give you a clear path. If it's not the right approach, we'll tell you and point you to what it is. Thank you and have a lovely day.